Hello everyone! Today we are going to talk about breast cancer. If you are a girl or woman, this video must be of a great interest to you. Breast cancer is one of the most common cancers around the world and one of the causes of death for women. However, it can be detected and treated early, before it spreads. So after watching this video, you'll be able to know the symptoms of breast cancer, when you should do the test to find out if you have it or not, as well as how this common cancer can be treated. So our role today is to answer most of your questions regarding breast cancer. Today we have Dr. Kim, who is a leading doctor at Bundang Jeseang Hospital. She is going to discuss with us everything about breast cancer from an experienced medical point of view. I am Ume. Before we start, please subscribe to our channel so the next time you'll be updated with our new releases. Hello, Dr. Kim.
안녕하세요.
Nice to meet you. Can you please present yourself to us?
Hello, I'm Kim Young-kyung, a breast cancer specialist in the Department of Surgery at Bundang Jeseang Hospital.
All right, Dr. Kim, we'll be talking about breast cancer today. So how frequent is breast cancer around the world?
Breast cancer is known to occur a lot around the world. If you look at the table here, the incidence of breast cancer among men and women ranks first with an 11%, and for women, the incidence of breast cancer is 25%, accounting for a quarter. And this picture shows the countries with the most breast cancer in the world by color. When you look at this picture, you can see that breast cancer occurs very often in most countries.
Okay. So what are the usual symptoms of breast cancer?
이 도표에서 보시는 바와 같이
As shown in this table, more than 50% of breast cancer patients complained of finding a lump in their breasts. There are many symptoms of breast cancer, such as lump, pain, and secretion of papilla. But the most notable thing is that more than 30% of patients had no symptoms, and cancer is found when examined. Therefore, it is important to get a checkup, touch the breast, and do a self-examination.
So what are the methods for diagnosis of early breast cancer?
The Korean Breast Cancer Society is making recommendations for treatment by age. As shown in this table, self-examination is recommended every month after the age of 30. Clinical examination is recommended every 2 years after the age of 35, and clinical examination with X-ray is recommended every 1 to 2 years after the age of 40. Therefore, self-examination is important, and I will explain how to self-examination. This is the shape of the breast. Usually, when self-examination is performed, it is necessary to look in the mirror and check whether your breast tissue is the same or different. Secondary, there is a way to touch it. I'll explain how to touch it with this model. First of all, when most people touch the breast, they touch it like this. But this is the wrong way. You have to press and touch it in this way, using 3 fingers, and it is necessary to touch the entire breast while pressing the surroundings to check for any abnormalities. If you can touch anything in your breast, you need to visit the hospital to check.
So what are the treatments for breast cancer and what does it depend on?
Treatment of breast cancer is basically divided into 5 categories. First, there are ways to treat breast cancer with surgery, followed by radiation therapy, anti-cancer therapy, anti-hormone therapy, and targeted therapy. In the treatment of breast cancer, the surgical method is to resect the breast. Breastectomy is largely divided into 2 categories. There is a way to resect the entire breast, and there is a way to resect only the cancerous part of the breast and shape it again with the remaining breast. This is a method called partial mastectomy and breast tumor plastic surgery. When performing surgery, it proceeds through the lymph nodes of the armpits. The first area where breast cancer metastasizes is known as armpit lymph nodes. Therefore, after performing a monitoring lymph node test to check whether the armpit lymph nodes are metastasized or not, an operation called lymphadenectomy is performed to resect all cancer if it is found.
전부 다 절제하는 임파선 곽청술이라는 걸 진행을 하게 되고 그러지 않고 검사만 진행할 수도 있습니다.
Other methods include chemotherapy. After the surgery, it is decided whether to proceed with chemotherapy according to the biopsy results. And these days, after postoperative biopsy, it is decided whether to proceed with cancer through genetic tests such as MammaPrint and OncoFree.
맘마프린트라든가 아니면 온코프리라든가 하는 유전자 검사를 통해서 항암을 진행할지 말지를 결정을 하게 됩니다.
Many patients undergoing surgery also undergo chemotherapy, and in this case, many complications occur because they attack tumor cells and grow rapidly while attacking normal tissues. In this period, many symptoms such as hair loss, stomatitis and diarrhea, and abdominal pain occur. And the most difficult thing for women is hair loss. However, hair usually grows again when anti-cancer therapy is over. Breast cancer is treated with drugs called anti-hormone therapy. This therapy is carried out by patients with female hormone receptor positive breast cancer. In Korea, about 70% of patients usually fall under this category. This method is a method of treating breast cancer by blocking female hormone action. Basically, there is oral medicine, so treatment is performed by taking the medicine once a day. Some of the female patients who have not come to menopause may be given injections that cause menopause. This injection takes a total of 2 years once every 4 weeks. Another treatment method is targeted therapy. This treatment method is a treatment method that about 20% of patients receive. It's performed if breast cancer has a treatment target and is performed about 18 times a year every 3 weeks. Previously, targeted treatment was performed only after surgery, but now that drugs and treatment methods are diversified, patients of this type are increasingly more advantageous to perform chemotherapy before surgery and continue surgery after that.
수술 전에 항암 치료를 먼저 시행을 하고 그 이후로 수술을 이어서 하는 게 더 유리한 환자분들이 있기 때문에 요즘은 그렇게 치료를 하기도 합니다.
Another treatment is radiation therapy. It is a treatment performed to patients who want to preserve their breasts while treating breast cancer. Treatment is usually performed 20 to 30 times and takes a month to a month and a half. Therefore, after surgery, the biopsy results are examined and determined.
Dr. Kim, hereditary anomaly of BRCA1 and BRCA2. Can you explain a little bit about it?
Before explaining hereditary breast cancer, let me briefly talk about breast cancer risk factors. If you look at the figure here, sporadic breast cancer caused by age or gender accounts for 7 to 80% of the total, 10 to 15% of the cases occur due to family history, and 5 to 10% of the cases developing hereditary breast cancer. Among them, breast cancer is found in BRCA1 and BRCA2. In 1800, it was first suggested by a French doctor that hereditary breast cancer occurred, and in 1988, evidence was reported that breast cancer phase chromosome dominant develops and inherits cancer. And BRCA1 in 1994 and BRCA2 in 1995 were separated. Genetic breast cancer accounts for 5 to 10% of all breast cancer patients. Genetic breast cancer develops into bilateral breast cancer before the age of 45 and develops into multiple cancers. Let's look at the table here. Looking at the current status of breast cancer up to 70 years of age, breast cancer occurs with a 55% probability if there is a BRCA1 mutation, and 39% develop ovarian cancer. and BRCA2 has a 47% breast cancer incidence and 17% ovarian cancer incidence when there is a mutation. In addition, it is said that the possibility of developing other cancers increases when both BRCA1 and 2 are present. The subjects of BRCA1 and 2 genetic testing are as follows. If there are 3 or more breast cancer family members, regardless of the age of development, if there are 2 breast cancer family members, including yourself, and at least one had a cancer before the age of 50, if you have a breast cancer and at least one family member had ovarian cancer, if you have breast cancer and also ovarian cancer together, if you had a cancer before the age of 35 or had bilateral breast cancer, in the case of male breast cancer, are the subjects of genetic testing. In the case of male breast cancer, the incidence is so low. It usually occurs about 1 to 2%, so it is necessary to check if there is any genetic abnormality.
So, what is the breast cancer treatment outcome?
This is a table showing how well breast cancer treatment and recovery are performed in Korea. Here, according to the year, breast cancer has a 5-year survival rate of 93% and a 10-year survival rate of 88% or more after treatment.
So, for the post-treatment management of breast cancer, what kind of treatment is that?
After patients are diagnosed with breast cancer and treated, they think about what kind of life to live in the future. First of all, it is unreasonable to think of treating breast cancer with a diet. However, diet can play an auxiliary role in breast cancer treatment. Studies have shown that postmenopausal women are at increased risk of recurrence and occurrence of breast cancer when they become obese. Basically, it is necessary to manage your weight, so it is better to think of exercise or diet as an aid. Mentality is also an important factor. Breast cancer is a disease that occurs in most women, so mental diseases such as loss of breast loss, anxiety, and insomnia can occur. Therefore, many mental treatments are needed along with breast cancer treatment. Since anti-hormone treatment promotes aging in women's bodies, a lot of help from patients' guardians or families is needed to care for the anxiety and depression that occur. In addition, if it is difficult for the family to take care of, it is very helpful for the patient to get help from a psychiatrist.
Okay, thank you so much, Dr. Kim. 감사합니다. So today we learned many things about breast cancer, and the doctor explained in details everything related to this common disease. Thank you for joining us once again at Cloud Hospital TV. If you have any questions or comments, please leave them below and we'll respond to you as soon as possible.